My name is Rashad Staten, Executive Director, Community Law and Action, founder of Catalyst to Change. I am here joined with my great colleagues from Baltimore City Health Department, Behavior System, Baltimore, and Baltimore City Public Schools. We are going to be hosting today Medicate over Medicate, Kids Off Drugs, a respectable presentation around youth substance abuse and prevention. This is a collaborative effort that we've done, which you all will be participating in today is our virtual programming. As we go along, you all will learn that we'll actually be doing pop-ups across our city school sites, as well as doing some community events. This one in particular is to engage everyone through a virtual space. Before we get started, we want to just figure out who is in the room. In the chat right now, I am dropping in a survey link. If you all can fill out this survey, let us know whom you are, our adult partners that is on. Feel free to participate as well in this survey and just click other. But we'd like you all to answer these questions as comfortably as you possibly can. All right. And without further ado, we're about to get started. If you in the chat, let us know how you all are doing. If you're having a great day so far, drop in a 3. If your day is going okay, drop in a 2. If it can go a little bit better and hope that it gets better, drop in a 1. But we just want to gauge you all right now. Go into the chat, click this link, let us know who you are, drop in some information about yourself. Ms. Green, you can connect us. Go to the next slide. All right, what I want us all to do is I'm going to share my screen and we're going to play this quick game. It's a quick Kahoot game just to see who knows about certain information. Without further ado, let's get it started.
Are you guys able to see my screen?
Yes, they are.
Okay, great.
All right, does everyone see my screen right now? We're about to play this Kahoot game. Join into Kahoot if you are joining us right now. We're going to take a few seconds. Code or use this QR code to jump into this Kahoot. We're going to use it as like a quick survey pulse checker, which you may or may not know. But before we get started, just know that everyone is a winner. But the person that gets the crown today, we will be actually cash apping you some money, either via Venmo, PayPal, or things of that sort. Information is knowledge. Let's see if we can get about 3 or 4 folks in. Miss Morale, you are in. Awesome. If we can get 3 to 4 folks, Cameron, I see you. Get up to about 3 to 5 folks and we'll get started. Those that are not able to get in so soon, you can answer it in the chat. All right. We got a lot of information to go through and we got about 38 minutes. So we're going to try to make it expeditiously by the words of T.I. We're going to use a lot of verses and bars coming from hip hop. This program is centered around hip hop culture and drug music in itself and how it correlates to Baltimore and all of us in our communities. Awesome. Let's see if we can get up to 10. Joy, give me like a 30 second to 1 minute countdown. All right, Tyler.
Hey.
Oh, we are in here. We got a full participation of 19. Let's see if we can get to majority of everyone. We got 30 more seconds.
30 seconds, y'all. Come on. Okay, let's go. We got 6 more.
Maya J. Awesome. Miss Lisa, if you want to join in there, I know we met you earlier before we got started. If you want to join in there and play in this game, feel free to. This is a community discussion and a program we open to everyone. George.
That's what you guys know. Okay, look at us, 14.
All right, and we counting down. Let's see if we can get everyone. All right. 10 more seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. All right, we about to get started. Joy, you ready? Miss Green, you ready?
Let's do it.
Perfect. Time to get started. At work. This is National Prevention, KOD Kahoot 3. 2, 1. Remember, you want to answer the correct answer, and the person that answered the quickest often gets the highest points, but all of us are winners. How many people ages 12 or older have used illicit drugs in 2018?
Now, this is in the country.
In the country. This is in the country, not Baltimore. This is from a national perspective. Guess which one is correct? One more second. All right. The correct answer is 1 in 15 based off of national data that come in. 1 in 15, 1 in 5 young people have used illicit drugs. That can range from marijuana use, overusing prescription drugs, methamphetamine, and other listings of probably 12 drugs listed throughout this research analysis. Give it up for the 5 people that's on there. Throw in some hand claps, some emojis, some yays in the chat. Light it up. Congrats for you all. Remember, let's continue to win together. For the other ones, take what you learned today and notice this, how close it has begun. It's more than 20 of us on here, so we can see how reality has already settled in. All right.
All right, George.
You got it. Caleb right behind you, and Miss Morrell, Scott, and then Desmond T. True or false answer? The risk of substance abuse increases for individuals who experience a decrease in income during economic recession. All that is to say, when we are dealing with an economic recession, do you think that it has been an increase in substance abuse use? True or false? When the country's doing bad financially, do you believe that some folks start to use drugs as a coping mechanism? All right, majority of us here, participants, have gotten it right. The correct answer is true. Unfortunately, there is a correlation between economic hardship and drug usage, right? So we'll talk about that through our presentation, but shout out to all 16 of y'all that got it right. Let's see who's leading. Kayla said, not today, I'm jumping in the front. All right, George, right behind Miss Morrell right there. Tyler, I see you in 5th, Desmond's in 4th. All right, y'all, let's keep going. 3 out of 8. Which of the following risk factors can increase an adolescent or young adult's likelihood to initiate substance abuse? Which one of these can be a risk factor that increase someone of likelihood of starting to use drugs? Y'all answer these quick. We got one more person that's thinking hard on it. Hey,
all right.
You're above. That was a trick question. The answer was all of the above. Every single one of them has played a part some way and somehow in someone experiencing or going into substance abuse, unfortunately. Miss Morrell is on a streak with 3 correct answers in a row, but Kayla said you ain't jumping in front of her. She is still moving the marathon quickly. Shamira has jumped up into number 5. Desmond has moved up to 4. All right, George and Kayla is competing with each other. Next one. Which substance abuse deemed illicit by the federal government has the highest number of users as of 2018? The federal government says this is the highest use of a substance in 2018. All right, the correct answer was, as of 18, things may have changed in 2 years, especially during the pandemic. It was marijuana. All right, so the 5 that got it right, I see it was a very differentiation between different answer choices. This one was thought-provoking. All right, let's keep going. Let's see who got this.
Morrell's in the lead.
Tough round. 3 players lost their answer streak of 3. So that was a very tricky question. Awesome. Let's keep it going. 5, we are halfway through. Addiction is a chronic relapsing disorder that involves long-lasting changes in the brain. This is a true or false answer. Remember, if you get it right, but it's also points given to those that respond the quickest. Addiction is a chronic relapsing disorder. All right. Only one person got it incorrect, but you learned something new that makes you a winner as well. All right, give it up to everybody for getting this one correct. The answer is true. We'll talk about addiction and what it means in our presentation. Again, this is just to gauge where we all are and meeting our folks where they are right now. Next one, how much do substance abuse and misuse and disorder cost the United States annually? All right, follow the money. How much would substance abuse cost the United States annually? Wow, no one got this one right. The answer is $400 billion annually. This is because of clinical help, medical help, violence and reduction and prevention strategies, death, insurance costs, and things of that sort. Most of the mental substance abuse often causes to other consequences and implications that are very costly by persons, agencies, institutions, and health systems. All of this is costing a big hit in our economy, up all the way up into $400 billion. So think of the implications. It directly impacts people's lives, but look at the cost itself. Second to last question, which of the following strategies have shown to help people who engage in heavy or chronic substance abuse misuse? Which one of these following strategies have shown to help? Hey, check y'all out. All of the above, got them again. Those that got it incorrect, the two, don't worry about it. You learned something new today. So now you can leave out with more knowledge that you came in with. The answer is all of the above. All of these strategies has helped and can be advantageous to helping someone to get their life back in order and to be back on a good track. Miss Morrell is up in the leads. George, Kayla, and Desmond is in fourth. Ngoza, I'm not sure how to pronounce your name. If you want to come on mic and correct us, let me know. I want to respect and honor your name. Perfect. All right, last question. It might have a negative effect on my job is a common reason for people not receiving substance abuse youth. True or false? True or false? Most people use this response or excuse for not receiving substance abuse treatment. True or false? All right, this was a split. Unfortunately and surprisingly, this was one of 6 based off of the data report we received from the National Prevention that says that this was one of the 6 common users of those that have not tried to receive any type of treatment around substance abuse, that they think it might unintentionally affect their job, either their performance or build some untrustworthiness between them and their employer. All right, let's see. Let's give some podiums. 6 out of 8. Kayla came in third. Let's give it up for Kayla. Desmond came in second. And George came in third. Awesome. Terry and Miss Morrell came in 4th and 5th place. What I need you all to do, if you can, Desmond, George, and Caleb, if you all can drop in and DM Miss Sharika Green, and just send us your Venmo, PayPal, or Cash App, however you can, and we'll drop in the email. If you can email that to us, we will make sure to send you our incentive prize for you all being winners today. So again, Ms. Green is going to drop in her email, drop in your PayPal, Venmo, or Cash App, so that we can send you your incentive for being a winner today. And remember, everyone else, you're a winner as well, because we are all learning together. Perfect. I'll stop and we're going to go back into our presentation. Thank y'all for rocking out and participating in this game here. Screen, you ready to go back?
Yep, okay, I'm going to share my screen now for the presentation.
All right, thank you all for participating in that. Again, welcome to those that just joined us. You are watching the Kids Off Drugs Meditate over Medicate, a collaboration with Baltimore City Public Schools, Behavior System Baltimore, Baltimore City Health Department, Catalyst of Change, and Youth up next. We're going to continue on to slide 3. You heard a lot from me, but now it's time to give it up for my colleague, Miss Joy Barnes, who's going to tell us a little bit about opioids, and then we're going to dig deep and talk about culture, community, and substance abuse. Go ahead, Joy, it's on you.
Awesome, thanks, Rashad, and hey, everybody. So I'm Joy Barnes. I'm the Overdose Fatality Coordinator for the Health Department. And so, of course, as Rashad has mentioned earlier, what we're going to talk about today is hip hop, health, and culture, and like what's going on not only nationally, but also here in Baltimore City. And so if anybody's ever had a poppy seed bagel, right? The seeds from that bagel are from the poppy plant. And that plant is actually how we have gotten all this entire classification of opioids. That one plant has been the derivative factor of how we've gotten opioids in general, and not just now, but even back as far back as ancient Greek times, etc. Opioids are a classification of drugs that are directly derived from the poppy plant. Why that's important is because this particular classification of drug is extremely strong, right? There are some that are, and there are 3 different categories. Opiates, which are naturally occurring, so like things that are found in nature, again, directly derived from the poppy plant itself. So that'll be opium, morphine, and codeine. Then we can move to semi-synthetic opioids, which are a mixture between synthetic and naturally deriving opiates. So those would include heroin, hydrocodone, Percocet, buprenorphine. And then we have full synthetic opioids, which include fentanyl, methadone, and tramadol. And why that's important is also because each of these also vary in strength. Our full synthetic friends are the strongest of this classification. And again, why that's important is because as people use substances, a lot of times they actually have no idea that what they're taking ranges in strength. If you can go back one slide, yep, to the fentanyl one. One more, go up one more. So one of the main things we're going to be talking about today is fentanyl. And if you guys could drop in the chat if you've ever heard of fentanyl, just say yes or no. So fentanyl, as we talked about earlier, is a full synthetic drug, or a full synthetic opioid that you typically actually get prescribed in a hospital setting. So you break your leg, you break your ankle, you have a surgery. They'll give you fentanyl in the hospital and typically in a patch that goes on your arm or somewhere on your body in order to kind of control the amount that you get. The difference between how we're seeing it in a hospital and how we see it in illicit drugs or drugs that you can buy on the street is the fact that in the hospital, you get it in micrograms, and in other drugs, you get it in milligrams, which is thousands of times different. And only 4 or 5 salt grain particles of fentanyl is able to kill a grown person. And so why this is important is the fact that from 2015 to now, we've seen a significant increase in the amount of fentanyl that we're finding in illicit drugs, and not just in heroin or cocaine, but in general being laced in pills and things of that nature on the street. So you might think you're buying a Percocet when you're actually, in all actuality, you might be buying a full fentanyl pill and have no idea. And neither would your local drug dealers either, because they're not the ones that are mixing the drugs, right? So again, why it's deadly, it's 50 to 100 times more potent than morphine. So if we just talked about morphine is not nearly as strong as a full synthetic opioid such as fentanyl. And again, 2 milligrams of fentanyl, which is equal to about 6 or 7 grains of salt, is a lethal dose. And sure, that varies for each person depending on your metabolism and things like that. But ultimately, it's that little amount can kill anybody. How are we getting it? How is it coming to America? Like, how are we getting it? And so it is being manufactured in places like China, Canada, and Mexico, being ordered off the deep web and mailed here. And so the Drug Enforcement Administration has to do its very best to catch all of those packages before they arrive here. But once they get here, unfortunately, it's very hard to kind of track where those drugs are going unless somebody passes away, unfortunately. Why is it so accessible? It costs less to manufacture that than it does to manufacture heroin or cocaine or anything else like that. You can because of its cost efficiency. At first, people were using it to cut other drugs, and now they're using it to replace the other drugs in its entirety. And so, yeah, unfortunately, again, we've taken this substance that, again, is typically controlled in a hospital setting for when there's a major injury, and now people are using it, and not for themselves because they didn't make fentanyl, right? Like, people who are using did not make the fentanyl, they did not go and find the factory. But unfortunately, now that those things are in our communities, we are seeing the ramifications of more people dying. Next slide, please.
Next slide, Ms. Green. All right. So thank you, Joy. What we're going to talk about here is pretty interesting. We're going to talk about some history of drug usage in Baltimore, how it connects back to the Be More story, how it shows up within the white owl and the black butterfly. As you all know, that drugs has been around for a long time, but you start to see an emergence of drugs hit the Baltimore streets as early as the 1950s. Yes, as early as the 1950s. If you correlate to that, you'll start to see it, even how it correlates to our musicians and artists of Baltimore, from the Billie Holidays of that time, all the way up into the Lord Scooters and everyone of today's world and those that have passed, right? But heroin began flooding the streets of Baltimore in the early 1950s as the end of the World War II came, in which much of our military veterans was exposed to the poppy plants and things of that sort, in which the war took place. That by the 1970s, you'll start to see an emergence of increased criminality and penalties from law enforcement surrounding substance abuse use, and the emergence of the war on drugs. Around the war on drugs, you'll start to see an increase in commercialization and the criminalization of Black and urban populous cities that brought the rise to the crack era of the 1980s. As Young Dolph say, early 80s crack baby, right? Kendrick Lamar says, which you born in 1990s, ADHD, right? He talks about these and how certain drugs and things have always been a part of our culture in earlier the 1980s. And surprisingly, I want to say 20 to 40 years later, we hear that the government has admitted to its own involvement in employing crack into our Black and brown communities in the early 1970s and the 1980s, which is still some of the implications that we're still dealing with today. By the time we get to the 1990s, you start to see an emergence, not just from heroin and crack usage, substance abuse usage, you start to see an emergence of pharmaceutical companies in dealing prescriptions that have been already misused around opioid pills, right? And which is still being correlated into our streets today as we talk about fentanyl and other substance uses that has hit our streets very heavily in our communities. But you start to see this blitz of the marketing from pharmaceutical companies come as early as 1990. So we went from heroin to the drug idea, the war on drugs, to the crack era of the 1980s to the 1990s and pharmaceuticals. You can go to our next slide and I'll pass it back to Joy.
So something to also mention about the 1990s. So as Rashad said, there was a pharmaceutical blitz marketing specifically opioids for pain management, right? And so a lot of doctors at that time really didn't have a whole lot that they could do when they had patients that had chronic pain. And so these companies preyed on the fact that a lot of doctors at that time really just wanted to do anything to be able to help. And yeah, there are some companies and organizations or even, physicians that might have gotten some kickbacks, for partnering with some of these companies, but ultimately at large at that time, doctors thought they were doing what was best for their patients because those companies were assuring the doctors and providers that there were going to be no drawbacks. Well, they said that not having any research done at all prior to kind of coming out and advertising these things. And so we see in the 2000s, as the 1990s come and there's a blitz in marketing for people to for providers to put their patients on pain medications, opioids. You see in the 2000s, the beginning ramifications of that, where now people are being overprescribed these drugs. And so there then is something in place called the Prescription Drug Monitoring Program, which kind of curtails some of the ability for doctors to overprescribe. However, that caused another negative effects where people were then put on these drugs for pain management. And when they're trying to get off, experiencing the same level of withdrawal symptoms that they would, using heroin or cocaine. And so with that significant drawback, you then saw people, as they could no longer get the same level of prescriptions that they were getting before, turn to street drugs. And so in 2010, we actually saw the price of heroin in the city decrease drastically. And now it's because of the supply and demand of the needs that people had at that time. It was just harder for them to not only get to be prescribed these medications, but also then it was harder, and also the prices, as it was harder for them to get it, the prices of those drugs increased as well. And so if you can no longer afford your prescription, what are you going to do? You're going to find somebody that's selling it, right? And so unfortunately, that's the reason why we saw the price of heroin decrease in 2010. And of course, in 2015, we know that we saw the beginning of fentanyl in our city. And that's kind of where most people coined the opioid crisis starting in Baltimore City. But again, as we talked about earlier, it's been here as early as the 1950s. And, and as communities already know, like, this is not news to us. Anybody that's lived through these things, our family members our families being broken apart, in the 70s, 80s, and early 90s from these different things. We just wanted to emphasize that this issue did not start in 2015, but fentanyl being in this drug supply in Baltimore City did increase at that point. And so from 2015, when we first saw fentanyl kind of come here, to 2019, we saw a significant jump from the initial just like cutting drugs with fentanyl to 85 to 92% of all illicit drugs in the city having fentanyl in them. And because of that, we had 914 overdose deaths in 2019 alone. And now the final numbers from the State Health Department for 2021, unfortunately, in 2021, we had 1,028 overdose deaths in Baltimore City alone, from opioids, but 90% of those were largely due to fentanyl. And that's the reason why we really have to be careful utilizing harm reduction techniques and making sure that we're not using alone, especially if you know somebody that does use, exercising compassion, care, and making sure that, we're doing our diligence to look after our neighbor is super important right now.
Thank you, Joyce. Ms. Green, go to the next slide. We got 14 more minutes, so we're gonna go through this one expeditiously. Those right here, quick. Go ahead.
Oh, sure. So as we said earlier, 914 overdose deaths in 2019, and that included alcohol and overdose as well. Same thing with that 1,028 number. That's alcohol and overdose. And as you can kind of also see from this bar graph, Baltimore City only comprises 10% of the state of Maryland's population, but honestly, we do account for 30% of all of the overdose deaths that happen in the state. And so as you can kind of see from this bar graph, a comparison between the number of overdose deaths we experience here versus other places. And we can go to the next slide.
All right, another Cash App question. Let's see who's the mathematical geniuses in the room. All right, based off of the data that Ms. Barnes just shared with you all, quick Cash App question, PayPal or Venmo, whatever best fits you, whoever drops the answer in the quickest. Ready, set, go. In 2021, there was 1,028 overdose deaths in Baltimore. 90% of them were from fentanyl. How many people died from fentanyl overdose? Per these numbers here, let's see who can correlate percentages to whole numbers. Let's see. You got Ms. Denise there. Mia jumped in. All right. All right. And Ms. Green is gonna make sure she'll notify who got that answer correct first based off of who dropped the answer in the chat, right? Once you get a message from Ms. Green, please then email her or send her your email address or Cash App, Venmo, PayPal account. All right, we'll notify who got that answer correct. Keep guessing, keep guessing, keep guessing. Ms. Green, we can go to the next one. We'll circle back and let you know who was that one. All right, so let's talk about this history of hip hop and crack music. For those that's been watching the Kanye West documentary on Netflix, he had one particular song called Crack Music with the Game, and it was very pivotal that talked about this whole history of crack and now music, as you all talked about in the 1980s. Now, what we're about to do is talk about hip hop and how hip hop has consciously and unconsciously have used the marketing of drug use on young people in our communities and how it has drastically impacted us. Some way, somehow, through the beats, through the music, through the lyricism and the messaging, we have all been bombarded with some idea or falsehood of drugs and its implications and its unintended consequences on our communities. Let's dig deep. Next slide. All right, in the chat right now, if you can think of some artists that you listen to, either R&B, rock and roll, anything, hip hop, rap, backpack rap, any type of music there that you know have promoted drug use, drop their names in the chat. What we did here is just drop in those that we know. Brent Fayez, yes. NBA Youngboy, Triple X, Extension, Michael Jackson. Yeah, that's actually true. All right, Future, yes. He said Percocets on a Mask Off challenge 147 times in 3 minutes. I don't think nobody beat that record. The Baby, and the interesting thing about that is Future don't even use drugs anymore, right? But it's the #1 marketing artist around drug and substance abuse. Kodak Black, Lil Baby, The Baby. I like Lil Baby. Baby doesn't curse in his music no more. The Baby does. All right. All right, so look at these here. These are different. What we did here was just select down some of the artists themselves and the correlation to substance abuse that they have openly admitted to being addicted to. Right, we have DMX, who was introduced to drugs at 14 years old. His own best friend laced his drugs without his knowledge, and he had a habit all the way up into his death. Since the age of 14, Kid Cudi, Flavor Flav, Mary J. Blige, Lil Wayne began using drugs at 11 years old. Joey Bad was openly admitted to using marijuana. Juice WRLD had died. Lil Peep, Mac Miller, and Fredo Santana. Mozzie speaks of lean, Fredo Santana, Gucci Mane, G Herbo, Fat Trell, Lil Baby, Offset. Then you see those that have been actually admitting to being addicted to prescription drugs. Right. So think of all of these artists that have made our top 100 charts and have climbed the ladders, and how their addiction has some way, somehow influenced our cognitive minds around how we look at drug usage. We're going to continue on. We're going to go through this one pretty fast. The next one is one we all know, one of Baltimore's favorite rappers. I want to say one of our favorite cousins up the street from us in Philly. Meek Mill speaks about his beef, the legendary beef with him and Drake, and how he speaks of how his opioid addiction to pills actually was the reason of him getting into a beef with Drake, where he wasn't able to think clearly and he was thinking out of emotion rather than logic. And he talked about how he popped 30 Percocets a day, and revealed that that was his blame for the infamous beef with Drake themselves. So has anyone, I'll step back, does anyone can speak of an experience or share or is aware of an experience where you've seen someone indulge in some type of substance abuse, and you know that that had altered their decision making and that wasn't normally their way of thinking and moving around in life? If you experienced that or you have seen it, drop in a yes. If you haven't, drop in a no. If you're uncertain, drop in a unsure. But we just want to gauge the room. Right. So if we see this coming from our artist who is going viral every day and is our entertainment, know that it will show up in our immediate families, our communities as well. All right. Thank y'all for sharing out and digging deep with us. Go to the next slide. We got 7 more minutes. So let's get to the Baltimore one, because I'm sure we're going to have fun with that one today. Oh, no. Let's talk about this Fredo one. Perfect. Joy, take this away. Talk about the relapse and then, yeah, go ahead.
So I don't know if anybody knows Fredo Santana, but he's from Chicago, was a really big rapper in Chicago. And he was very open about his journey to recovery. We also know that relapse is a part of your recovery journey. Same thing if you quit drinking soda and one day you decide like, oh, maybe I'll just have a little bit, same kind of premise with that whole thing. That's, sometimes we experience relapse, and that's not necessarily a moral failing or that you failed or anything like that. It's just you fell off the horse and we got to get you, and people have to get back on. So unfortunately, he was diagnosed with liver and kidney failure due to his use of lean, his excessive use of lean, and went to rehab for it and was getting support for it. And before he died, he'd actually not had a sip of lean in 2 months before he died. But unfortunately, when he relapsed, his tolerance was lowered, and unfortunately, he passed away due to complications from his previous substance use. And that's important because, next slide, real quick, Jacob. And that's because we kind of see things like this all the time in our families, in our friend groups, in our schools, in our communities, where we know individuals have an addiction to not even just substances, but in general have an addiction to whatever it is, and might start romanticizing the past, like, oh, I remember when we used to do X, Y, and Z. Like, you remember that? You want to go back and start doing that, or start becoming friends with people that they stopped being friends with because their lifestyle did not align with their journey. Or will start making excuses about how they can, like, dabble or take a little bit of whatever it is, or indulge in a little bit of whatever it is. So these are just some things to be mindful about, like when we look at our own friends, our circles, our communities, some potential signs of relapse, people romanticizing what they used to do and going back to old friends and some old, habits, and how we can support them literally is just making sure that we hold them accountable, and not in a judging way, but in a way that's loving, in a way that's loving, but also firm, like, hey, like, like that's not you said that you wanted to do this, so let's not go back to that, and not indulging in those behaviors with them, right? And we can go ahead to the next slide.
Okay. Now, what we're going to dig is dig deep to it. What Baltimore does in our Baltimore narrative and our stories, of course, the tale of two cities. We see some of these artists and things of that sort. What you're looking at on this chart is some of our Baltimoreans, right? The rap songs from our own city, our storytellers, our artists, those that have been played on 92Q, those that we are streaming in our earphones and things right now. What I want you all to try to do in this quick, short time, try to match up which one of these number slated verses actually connects to the drug or the substance abuse here at the bottom: fentanyl, lean, prescription drugs, heroin, or crack, cocaine or crack. Right? Try to match. Does one go with lean, fentanyl, prescription drugs? Do two go with prescription drugs, heroin, and things of that sort? Try to match them up in your thing. And if anyone can try to guess these Baltimore rap artists that actually have promoted substance use in their music, try to gauge that as well. Right? I see we got Lil Scooter on one. Who's the other artist as well? Right? That has it. I think even the Baltimore Ravens and the Orioles use the bird flu, right, for our own sports and entertainment world without even knowing what they was actually promoting over the large marinas, which is interesting, right? So look at how we have used drugs to influence our culture, both in the sports and entertainment world, how has that negatively impacted our music and our decisions in our community. All right, so that was one of them. Outside, go back just as a quick glance. So we've heard of all of these different rappers that we just watched, but have you all heard of our actual literary giants and authors that tell of the other side of the story of drug usage, right? That doesn't beautify the glamour and the glories of it, but talk about the implications, the consequences, and how it has drastically impacted our community. One in particular is D. Watkins, who created The Cook Up, a crack memoir where he talks about how his family and his close friends have made a fortune off of drug usage, but has lost just as much, right? Drugs seems to be the thing that is taught every day, but it has been correlated to us losing bodies and spirits and souls on the streets, right? So as we go through, I wish we had that time to drop it in with Black Chakra. You want to do that, or we want to close out with some next steps? All right, to watch the Black Chakra, y'all got to look forward to our next presentation and see if KOD pop-up is going to pop up at your school and or around your community, where you'll get to meet some of these people that are part of our presentation today in real time and in person. All right, we're going to keep going. These are some of the other listings of Baltimore authors and literary giants that tells our story in a, I want to say, a very advantageous and positive way. How do we negate and balance out the negatives and the things that is teaching us to be destructive with things that are being powerful? These are some of those authors. Was there someone trying to say something? All right, go to the next one. All right, and now we're going to close up on how can we all help and play a part in building safe and healthy neighborhoods and how to make conscious decisions. Yes, we definitely should include MK Asante. MK Asante was both me and Joy's professor at Morgan State Go Bears HBCU. Right, the story of Buck. We know him personally.
Yeah.
So we would definitely include him in that
Right,
listing and some of our sisters as well. Thank you for lifting that up, George. Go ahead, next slide. Enjoy, it's on you.
So when we're talking about substance use, one thing that we always say, like, if you don't remember anything else, I want you guys to really like take this home. If you save someone's life today, they have the better chance of making a better choice tomorrow. And that is something that's really, really important. If you leave somebody to their own devices, just like, oh, well, they're outside, they strung out, they're whatever. Yeah, and if unfortunately they won't have a chance to make a better choice tomorrow. But if someone intervenes, if somebody really again, like takes the time out to figure out one, like the course of their life, because it's not just as simple. Nobody wakes up and wants to be addicted to drugs, right? Like nobody chooses that. There are lots of life factors that kind of dictate if that's going to happen or not. There are plenty of people who use and are completely fine. Unfortunately, that's just not the reality for everybody, right? So if we save a life today, people have a better chance of making a better choice tomorrow because they're still alive enough to do so. And I just want everybody to kind of remember that when we're thinking about substance use. To the next slide. So really quickly, how people become addicted is through as I kind of mentioned earlier, a multitude of factors, right? Some of it's genetics and biology, predisposition to addictive personalities, home environment, seeing substance use in their communities, in their household, not feeling adequate, peer influences, and then also what they're using and how they're using it, right? Like if you're 14 and start using injectables, that might be very different than, being in your 40s and snorting cocaine or something like that. Also cost of the drugs as well. That also was a big a big deciding factor on what people decide to use and how often as well, if they can afford it or not. And the reason that this is so important to know is because like addiction actually changes the chemistry in your brain. When I said nobody wakes up choosing to be addicted to drugs, that is real. Like that's not a euphemism. Nobody decides for the chemistry in their brains, for their neurons, for everything in their brain to be rewired to chase after the high that they experience when they get high. Nobody, not one person. And that is something that we really just have to remember. Next. So some ways that we can help if we see somebody having an overdose in and of itself. Here are some ways to identify if that's happening. Now we have something that is coined the Baltimore lean, sure, but that's not necessarily indicated as somebody's having an overdose. They might just be enjoying whatever they took, right? But it's up to us to kind of like ask questions and like double check and make sure before we just walk away from the person. So a sign of an overdose is if that person is not responding to stimuli. If you touch them, they're not waking up. If you yell at them, they're not waking up. If you try to see if they're breathing, it's not like they're not breathing, or it's like a very gurgly noise, like a really like ugly snore. That's them trying to breathe, but they can't. The pupil is very, very small. If you lift up their eyelids, if they're passed out, their fingertips and lips might look blue or gray. If you take their pulse, it's slow or low, or if they have cold, clammy skin. So those are some signs of an overdose. Bonus, they might be having a seizure as well, because sometimes we do see that as in addition. Next slide, Sherika. And so if you see some of those symptoms and you're not necessarily sure what's going on, one is try to wake the person up. That doesn't even mean you have to touch them. Like you can yell at them like, hey, are you okay? Like what's going on? And if they are not physically responding to you, you're going to call 911 and say that there is a medical emergency where you are, right? If they ask for other identifying factors, you can tell them what you're wearing, where you are, and stay with that person until 911 comes. But make sure that you say that it's a medical emergency, because you have no idea if it's an overdose or not. They might be in a diabetic coma. We really don't know. The third step is, if you're comfortable, to administer naloxone if you have it. And if you don't have it, what you're going to do is try to put that person into the recovery position if you're comfortable with that. But administering naloxone is really important. What you're going to do is take if you use Flonase, you're going to put the plunger in someone's, place it at the tip of their nose and squeeze up. One dose is one plunger. And you're going to wait at least 90 seconds before you give them the second dose if they don't wake up from the first one. But again, if they're not waking up after you call 911 and give them the Narcan, what you're going to try to do is put them in the recovery position as seen on the next slide. And that's to ensure that they don't roll over in their sleep or choke on their vomit or as they're coming to, or lay on their back as they already can't breathe, et cetera, because that just compresses the lungs and they won't be able to breathe. And thank you guys so much for our presentation. Sorry we had to kind of fly through the end of it. Thank you guys for staying with us. If you guys have any other questions or concerns for us, or you want to see more of KOD, that last slide is all of our contact information, and we'll also drop it in the chat.
Awesome. Thank you all as well. We might have time to go over our exit survey, but I thank you all. If you actually enjoyed this presentation, drop in a 3. If you think it went extremely great and it was powerful, drop in a 3. If it was all right and okay, drop in a 2. If it could have been a lot better, drop in a 1. That's how we just going to gauge the feedback for right now. So if you enjoyed it, drop in a 3. If it was okay, drop in a 2. If we could have did a lot better, drop in a 1. Again, thank you all. You have our contact information. If you would like for us to bring KOD, Meditate over Medicate to your program, to your school, let us know so we can be of any particular support. Thank you all. Y'all stay blessed and have a great day. Perfect. Yeah, we are scheduled to come to Reginald F. Lewis very soon, before the end of this month.
We're really excited to see some of you guys at your schools in person, bringing some local celebrities to come talk to you guys as well, and to bring this information to you in a way that you guys can really understand and connect with, like through art and music, other performances, and to kind of really make sure that we're having these conversations on a scale that the youth can talk amongst youth can talk amongst themselves as well about these issues, because we understand, we've been youth before, how this impacts all of us. So thank you guys.
Thank you, thank you, thank you. Okay, if we can.
So I saved the chat. I'm gonna go through and I'm gonna send the Cash App